in-office verification is an important aspect of successfully fitting rigid gas-permeable contact lenses. The Radiuscope plays a major role in RGP verification. Mastering this instrument is easy with proper training and practice. The Radiuscope is specially designed to measure contact lens radii of curvature, one of the most significant parameters affecting overall lens performance. It can also assist in distinguishing surface problems or material defects, in addition to determining lens flexure or warpage. The concave surface or base curve radius of an RGP lens directly affects lens wearability. This back curve is most often referenced and measured by labs and practitioners. A spherical lens has only one base curve radius and is the simplest to measure. A toric lens has 2 or more radii, depending upon design. It requires a few additional measuring steps. Begin by cleaning the lens to be measured. Be careful not to flex or squeeze the lens excessively. This could induce temporary warpage and result in incorrect readings. A radiuscope is essentially a microscope with a measuring gauge. An RGP lens suspended in solution acts like a mirror, reflecting light back into the ocular to form an illuminated target. To begin, switch on the instrument and adjust the illumination to suit your preference. Place the lens, concave side up, in the well of the lens mount. An eyedropper is helpful for filling the mount with saline solution. Make sure the lens is floating freely. A tissue is helpful for dabbing away excess saline in the mount. Also, make sure the concave surface remains dry. If not, the resulting image will appear blurred and will be difficult to measure. Place the mount on the radioscope in a reasonably level position and allow a few moments for the lens to settle. This allows any temporary toricity to pass that could have been induced by handling the lens. Slide the light aperture to select the larger opening. Turn the coarse adjustment knob until the microscope objective bottoms out. Observing from the side, adjust the lens mount in order to position the green light at the center of the lens. This allows the optical center of the lens to be measured. With the coarse adjustment knob, raise the microscope body all the way up. This is the starting position. Keep both eyes relaxed and open when looking into the ocular. Use the scale focusing knob to sharp focus the internal measuring scale. Turning the coarse focus knob, lower the radioscope objective until the spoke pattern target, known as the aerial image, appears. Adjust the stage plate as needed to keep the target image centered in the field of view. Continue lowering beyond the point where you see the image of the lamp filament until a second target, called the real image, comes into view. Use the fine focus knob for obtaining sharp focus. With the index adjustment, set the line marker to 0 or the whole number closest to 0. Finally, turn the coarse adjustment knob up until the aerial image is again in focus. Fine adjust as necessary for the sharpest image. Note that all the target lines are in sharp focus. This indicates the lens has a single base curve or is spherical. The index line marker highlights the base curve radius value. Since the original setting was 0, record the reading exactly as shown. In our example, the base curve radius is 7.5 millimeters. Record the reading. Repeat the measurement procedures a few times to confirm the accuracy of the original value. This first reading is most susceptible to error because the lens may not have stabilized or settled properly. Verifying the radii of curvature of a toric lens involves a few additional steps. There are 3 kinds of toric lenses: front, back, and bitoric. A front toric RGP has 2 central front curves and 1 central back curve. A back toric lens has 1 central front curve and 2 central back curves. A bitoric lens has 2 central curves on both the front and back surfaces. With a toric lens, the target lines 90 degrees apart must be brought into focus separately. A toric lens surface has two different radii located at right angles to each other. Readings must be taken at each focused image. To measure a toric back surface, mount the lens centered in the field of view. Turn the coarse adjustment knob to raise the objective lens all the way up. Now, lower the objective until the first aerial image target line comes into best focus. Slowly rotate the lens mount until the target line is sharp and clear. This is the proper orientation for measuring the first power meridian. Lower the objective, continuing through the filament image until the real image target appears and focus it. Set the index adjustment to 0 or the nearest whole number to 0. Once again, raise the objective through the filament until the original aerial image target line comes into sharp focus. Read the lens radius directly from the scale. In our example, the radius is 7.94 millimeters. The final step is to focus the spoke 90 degrees away. The second radius is 7.4 millimeters. The lower of the two readings is the meridian with the steepest curve. The higher reading is the meridian with the flattest curve. When reading the radius values on the internal scale, add or subtract as necessary to account for the original index marker setting. In our examples, the original index setting was 0. Therefore, the values could be read directly off the scale. It's good practice to repeat measurements a few times to confirm your findings. A distorted or difficult to focus target image may be the result of a dry lens mount. Adding saline solution will solve the problem. A dirty lens. Proper cleaning will significantly improve the image. A warped lens. Similar to the appearance of a toric lens, the warped lens target pattern will have two different focus points, though relatively close together. Be aware that there is a clinically significant level of warpage. A slight lens warpage may be acceptable if no signs or symptoms are observed or reported by the wearer. The front curve radius of an RGP lens can be measured to determine whether it is spherical or toric. A special mount is used to position the lens with the convex side up. For front toric lenses, the order of the aerial and real images are reversed. All other measuring procedures are identical to those viewed earlier. In review, always clean the lenses to be measured. Keep the concave surface dry to obtain a clear target image. Always begin with the right lens to avoid confusion when recording values. Center the lens in the field of view. Take multiple readings of each lens to ensure accuracy. Proper verification is an integral part of successful RGP lens fitting. With periodic review of this program and practice, you can maintain a level of skill with the Radiuscope which will assure better lens fitting, quality, and patient comfort. Refer to other programs in the CLMA and RGP Lens Institute video library. These videos are designed to assist eye care professionals, assistants, and students toward the improved fitting of RGP lenses, including keratometry, verification, modification, and lensometry.